inside. But in there, the flight of stairs that led down to the dungeons was filled with darkness. As I rushed across the hushed hallways and I reached the threshold of the demonic world, a scream tore through the silence and pierced my ears. A chill ran down my spine. Good afternoon, fellow Toastmasters and guests. This was not a scene from a horror movie, no. This was the first time I took a step into the department of oral surgery back in my college. The first thing that hit me was the dizzying stench of disinfectants and bleach. This place was known for its tyrant rulers, where a group of 7 professors, each a stickler for discipline, ensured that the students turned into slaves. This was the place where each second was an adrenaline rush. This was the place we could get our hands full of blood. We used to call it the stab lab because this was the place where all the surgeries were performed. Can you all tell me what is the most important thing that is required before doing a surgery? Let me rephrase the question. Who all are afraid of this? What if I tell you to hold this and stick it into your neighbor's mouth?
I will not have that courage.
That, ladies and gentlemen, was the exact thought that ran through my mind when I was first put into that situation. Today, giving injections is a mundane task for me, but that is not how it all started. Learning how to give injections is a rite of passage for my medical students, without learning which we can never step out into the real world. Having gone through months and years of trainings, lectures, videos, demonstrations, simulations, working on dummies and mannequins, this was the day where it all boiled down to clinical practice. I was excited at the prospect of giving an injection, sticking a needle into someone's mouth and pulling the teeth out. So, as was the routine there, we were handed out case sheets of patients as if being distributed chocolates, one for each. And when I went through the case history, I thought, this looks pretty easy. I put it down aside, the case history. Very confidently, as if I had done it 1,000 times, I rolled up my sleeves, washed my hands, gloved up, picked up the syringe. But one look on my patient's face and the realization that I was going to stick this pointy needle inside the mouth of a real, living, breathing human being struck me as a jolt of lightning. I turned sideways and I saw that group of 7 professors glaring back at me just as an eagle eyes its prey, waiting for me to make one mistake. And the words of one of them reverberated in my mind. He used to say, "If patient has pain, I will give you pain." My heart began to race. With a trembling hand, I advanced the needle near the patient's mouth. Sweat rolled off my forehead like liquid beads. What if I miss? What if I inject into the wrong side? What if the needle breaks? Some 1,001 what ifs raced across my mind. And I could sense that nervousness in the patient by the way he was holding on to the handle of the chair, as if holding on to dear life. I froze. I let that moment pass. I took a deep breath, mustered all my courage and pushed the needle into the gums. There, finally, I had given my first injection. But, ladies and gentlemen, the story is not over yet. The main picture is yet to come. This old gentleman needed an extraction of his upper back tooth. Ever pulled out a cork from a bottle? That's exactly the feeling that you get when you pull someone's tooth out. I picked up the tool, got a firm grasp on the tooth, and started pulling it with all my might. To my utter disbelief, after struggling for 15 minutes, the tooth just did not budge. I was holding on to it helplessly. One look towards my professor, pleading with my eyes to come and rescue me. From the corner, he shook his head in despair, walked towards me, grabbed my hand and pushed it, and pop, the tooth was out. And while he walked back, he said, sometimes you have to be tough. Ladies and gentlemen, that was the day of realization for me. I went back home exhilarated, happy, excited at the prospect of having given an injection for the first time, having pulled out somebody's tooth for the first time. Believe it or not, I even dreamt of that episode that night. But what I learned from this is, if I hesitate to take a step, if I don't toughen up, I will never know what lies beyond. Don't let those what ifs stop you from taking that first step. Because sometimes taking that first step is all that's needed to set the ball rolling. Thank you.
Thank you so much.